Hello and good evening, everyone. Thank you so much for joining us. Tonight is going to be really interesting because it's really important to know that most heart attacks, strokes, cancers, and metabolic diseases, they don't come out of nowhere. They build silently for years. And that's what we're going to be talking about tonight. We are going to be exploring how your genetic information can act as an early warning system, helping you to identify those red flags, those health risks before symptoms appear. And we also are structuring preventative frameworks that are being offered in the website called selfcheck.org alongside the genetic insights. And we're going to show you how to prioritize screenings, how to look at lifestyle changes, and even how to have conversations with your doctor without becoming overwhelmed. So, this is going to be a very important webinar for you. And I have the absolute delight and honor to be hosting tonight with my good friend and colleague, Justin Harris. By the way, everyone, if you are new to us, I will introduce myself. My name is Dr. Laura Varden. I'm Dean of the DNA University and an in-house clinician here at the DNA Company. So welcome, Justin. How are you this evening?
Good, good. Thanks everybody for showing up. We got another great topic tonight. This is an important conversation to have too, because genetics, they really represent a baseline tendency of our cells, right? So a gene and a genotype are going to operate as like a construction blueprint that your cells are going to read as they build your physiology day after day. They build it, they create it. And I think that red flags are actually one of the reasons why people don't get genetic testing, right? Like they avoid it because of that anxiety factor. But this really is a logic fail because genetic information should be illuminating. And it can actually help you to understand how you need to steer the boat to avoid that iceberg that is a cancer diagnosis or a cardiac event, etc. So I really think that having a good grasp on how your specific genetics work can guide you, right, to implement the best quality lifestyle decisions, which completely harness your epigenetics to hopefully prevent that health outcome from happening that we don't want. So tonight, we're going to discuss the tools and the genetic considerations for helping people to protect themselves. There's really no more important consideration than that with what we do, Dr. Laura.
Absolutely. And, when you consider that, these silent risks, and they really are silent for many years, they accumulate. And a lot of people miss these early warning signs. They don't register going, oh, this is something I need to pay attention to. And really, the real issue is the not knowing what to prioritize. You know, when when we consider prevention, oftentimes prevention fails when that risk starts feeling overwhelming and not knowing where to start. And this is where genetics, especially functional genetics, functional genomics, like what we offer, here at the DNA Company with our test, our DNA 360, that information can act as that early warning system, not a diagnosis. Okay. And I want to emphasize that your genes do not diagnose, but they can give you those red flags for you to have awareness, to be more curious, to start looking and go, hey, what is this telling me? What do I need to be aware of? Not as a factor of going, oh shit, my life is over, and taking that extreme view. Okay, this is a matter of empowerment with education and information for then you to go forth with that empowerment to your doctor, and also to help you be on the path of prevention instead of waiting for the wheels to fall off and then go, damn, getting a diagnosis and then, going through the whole system. So I would love to see if you can type prevent, the word prevent in the chat. if you'd rather act early than react later. Yeah, see.
Yeah, I'm seeing a lot of prevention. We didn't even finish talking before people started typing preventing there. That shows
Beautiful.
you.
So, another way that we are informed about our audience, what you are looking for, what is important to you, is that poll question that came up at the beginning. And so every time we do encourage you to fill that poll out, because that helps guide us into our talk. We do actually sometimes, adjust things that we emphasize in our webinars based on that information. So I'm hoping all of you filled it out. Justin, would you please do the honors of reading that for us?
Absolutely. And thank you, team, for pulling that up so promptly. So, we asked you guys a handful of questions to get a good read on why you're here and what you would like us to be discussing tonight. So, the first question is, when you think about health risks, how do you usually feel? And we listed, calm and proactive, somewhat overwhelmed, anxious, or that you avoid thinking about it. And 43% of you said calm and proactive. Fantastic. That's the best strategy that you can have. 38% said somewhat overwhelmed, and then 16% said anxious, and only 2% said that you avoid thinking about it. All of the above are acceptable, frankly, right? I mean, it's a tough conversation to have. That's why we're here, is to kind of help arm you with the right information, because we operate in this, we call it the subclinical realm, right? And subclinical really means like preclinical. So it's like doing what we can before it becomes a problem. That's where I love to operate as a practitioner. But sometimes things have already shown up or they've gone too far and we need to work backwards a little bit. But it's perfectly fine to feel anxious about these kind of things. But the more information you have going into it, the better off you're going to be. So that's why we utilize genetics and things. The second question is, have you ever delayed a health checkup because you didn't know where to start? Wow, a pretty even split here. 23% said yes, 23% said sometimes, 25% rarely, and then 29% never. So about as even as it gets on that one. Number three, what area of health feels hardest to prioritize right now? And the biggest number showing up is metabolic health, right? Diabetes and weight control, blood sugar management. So we'll tailor our conversation a little bit towards that tonight. Another 18% said heart health, cardiovascular stuff. We've got a great cardiovascular panel in the DNA 360. 9% said cancer screening. And then actually 32% said mental or brain health. Yeah, these are the things people are talking about and want to know about. So we'll make sure that we guide our convo a bit towards that tonight. Question number 4, do you believe genetics can help with disease prevention? Almost all of you said yes. At 85%, 12% said probably, 3% said not sure, and exactly 0% of our audience, Dr. Laura, said zero or said no. So good. We know who's here and who's with us. The last question that we asked is, would a clearer prevention roadmap make health decisions feel easier? Almost all of you said yes, absolutely, at 82%, 17% probably, 1% not sure, and nobody said no. So that's great. And that's what we're here to provide, is some tools and tactics.
Absolutely. And thank you so much, everyone, for filling that out. Again, it's really interesting because we must have read your minds beforehand as far as the metabolic aspect being of major importance to the majority of you, because we're actually going to be diving into the weeds a little bit more specifically in that metabolic health and prevention. So glad we're all on the same wavelength. In any case, let's talk about what red flag genes are and what they're not, because this is very important. And I know I mentioned this a little bit earlier, but it's important to reiterate this, because most people, they don't avoid prevention because they don't care. You're all here because you care. A lot of times people avoid it because they just don't know where to start, or they don't know how to interpret it. Okay. So one of the things that we're going to do is Justin is going to be introducing selfcheck.org. That's chec.org. And he's going to be introducing that as a library of self checks and doctor checks that are organized by disease area with age guideline pages and practical tools. And like I said, Justin is going to walk everyone through, give you a demo right here live, and actually show you how to navigate the page. Now, then we're going to get into the red flag genes. And that's where I'm going to hop in because I'm really going to be focusing and highlighting where increased susceptibility can be. I'll be identifying the certain systems that are under strain and really kind of give you a better insight on how to prioritize monitoring and prevention based on those genes, based on the systems that Justin's going to show you on selfcheck.org. Now, something that red flag genes are not. They are not a diagnosis. They are not a guarantee of disease. And they are not a reason to panic. Remember, I said, put your mental state in a state of curiosity, in a state of calmness, of education, of informing yourself so you know how to best navigate what to pay attention first, how to do this, not to be overwhelmed. Remember, I'd eat an elephant one bite at a time, and it's the same type of thing. And please remember, and we've said this on many webinars before, genes load the gun, but it's environment, behavior, and time that pulls that trigger. So really, why am I emphasizing all this? Why are we saying this? Why does it matter to me, to you, to everyone here? It matters because any misinterpretation of genetic risk can increase anxiety. Not just increase, it can cause it and increase anxiety. And obviously, we don't want to do that. We want to keep mental health calm, safe, but also if that's an area where a red flag is, being aware of that is half the battle. And you'll know what to look at and how to focus and preventative strategies to employ. Also, ignoring genetic risk, sticking your head in the sand, going, I just don't want to know. Okay, that can cause missed prevention. Okay, you're all here. You all put prevent in that chat. This is part of it. It is knowing what's going on, what you have to work with, your blueprint, so you know where to put that focus. And finally, the goal is calm prioritization. Curiosity, calm. Any words of wisdom from you, Justin?
Yeah, this is such an important thing to recognize, this relationship between genes and epigenetics, right? Because genes, they're very, very upstream, right? It's this encoding process that tells the cells how to behave, tells your liver to act like a liver, tells your neurons to act like neurons. And that's like the hardware of the system. It's not something that we can change. That's the baseline tendency, like I mentioned earlier. This is how the cells are reading an instruction and saying, we do this. When we have tools and labs and protocols and things that we can kind of use to peer into the downstream, that gives us an idea. That's what these assessments are about. There's a relationship between genetics and assessments, being lab work and self-check tactics and things like that. The self-check tactics really show you what the downstream is showing up as. What is it looking like? And so when we successfully pair these two things and marry them together, now we understand the upstream of the upstream, and we understand how things are actually showing up. And that allows us to control everything in the middle, right? Everything in the middle of that is your energy, thoughts, and actions, your lifestyle, the supplements you take, the food you eat, the way you exercise, the way that you train and think, and all these different things. That's epigenetics. The epigenetics is the software that goes over top of the hardware. you can upgrade software, you can change software, and that has an impact on how the system actually functions. So we're talking about how to harness the different tools and things like that. With regard to what we've been talking about here, this selfcheck.org website, it's a tool for hopefully being used in that subclinical setting that I mentioned. And it's a great tool for that self-assessing of red flags. It's a nonprofit health awareness website that's focused on that early detection and prevention. So again, subclinical, preclinical, of cancers and other chronic diseases. And what I like about it is that it encourages people to take that active role in their health and, doing regular self checks and healthy lifestyle choices. It's got a great recommendations page and things on there as well. So this site, it provides guidance on recognizing the early warning signs, understanding family health history, and then preparing for medical appointments and building habits that reduce the disease risk. So I like that. The self-responsibility, I think that's where healthcare is ultimately going and should be going. So I'm going to give you guys a quick demo, and then I will unleash Dr. Laura on you to talk about some of the genetic considerations here. So I'm going to share my screen. All right, can you guys see my screen?
Yes.
Excellent. Okay. Okay, so this would be the home page of the website, right? So this is selfcheck.org. I scrolled down a little bit because it has a bit of volume right off the bat, so I wanted to make sure that I didn't get on that. And basically, as you peruse it, it talks about some of these differences, right? So for men and for women, there's different things that are of a priority to check out. For men, colon, lungs, prostate, these kinds of things. Each one of these is a clickable icon, and you can go through and it'll talk about the self-assessments associated with each area. Same thing for females. And then as you scroll down, like I mentioned, this is all the epigenetic stuff. So it shows you the different, healthy habits that you can work for reducing risk in the various areas that matter. And then it's also got this toolkit, which you can also find at the top toolbar, but it's got a great newsletter that they have. It helps you to find a health professional that's actually suited to you, understand your family health history, things along those lines. So when it goes into this self checks area here, this is what we're talking about, right? So the main things people are worried about: cancer, cardiovascular related things, diabetes, obesity. That's what you guys mentioned in the poll. So these are great things to look at. If I click on the obesity segment here, it's going to load it up and it's going to go over a whole bunch of different types of health assessments that you can do on your own. And you can do these regularly, right? So how to actually check your BMI, how to measure your waist circumference. And then it goes into a bunch of the different risk factors as well, right? So it talks about the blood pressure consideration, the different cholesterol things to take into account. And then, of course, it's got the lifestyle factors associated with it as well, things that we can look at. If you are suboptimal for your genes, this would be a great area to go. It talks about various side effects. There's even an FAQ page as well. And that's just for the obesity side of things. So again, you can go into any one of these: cancer, heart, diabetes. It can go into the healthy habits here. There's the different tools that you can check out. So it's a pretty good website. I encourage you guys to peruse around it, and that will allow you to really know how to use this tool to understand if these red flags genetically are showing up or not. So that would be the website. And of course, we correlate absolutely everything with the genes. I'm going to stop sharing now. Is it back to my handsome face or no?
There we go. Yes, it is.
So yeah, that's the website. Again, we have a toolkit, right? Practitioners, each one of us has our own toolkit, and we use different things. But this is all about getting people into that self-care realm, right? What we do is all about that opt-in self-care model, so that you don't have to be forced into that disease care model later on. And this represents one of those tools. And if you understand your genes, which is what Dr. Laura is about to go off on, I'm sure, that really gives you the idea of what areas do I need to pay attention to the most, because at a baseline physiologically, these are the areas where your cells are not given good instructions for what to do.
Wonderful. Well, thank you very much for that. And Hope that walkthrough wasn't too quick. I think that was very well done because I know that we're going to be spending a little bit more time on the red flag genes, these pathways, the assessments that we have set up in our DNA 360 reports, so that way you can turn around and take a look. And we actually have some slides that we will be sharing that offer the information on these systems that Justin has so kindly shared with us from that site, and how that works into the pathways, where you will find that in the DNA 360 reports, and then diving into the genes, well, some of the genes anyway, that influence that pathway, what they do, why they're red flags, some preventative implications, and also ways that you can talk to your doctor about these things. So let's start diving in. And because Justin walked through the metabolic aspect, which, by the way, please take time after this webinar to dive into that selfcheck.org. Start looking around, poking around, and see what interests you. If you've done your DNA 360 test already, have that handy as well. And that way you can actually bounce back and forth and take a look and see what is most important for you. Also, I would definitely encourage you, if you have not already, if you haven't already gotten your DNA 360 test done, please do so. We have enhanced our the genes that we look at and that we report. We've updated our website for those report readings. So any new DNA kit that you order will include all of our new genes. If you have done your DNA 360 in the past, then we're talking anything since, well, actually anything before December, then I highly encourage you to go on our site. You can go, and actually, you probably have already been sent an email about this, that you can actually upgrade to the new genes. And so please do that, so that way you do have access to all of the new genes that we have. All right, so diving in, the red flag genes and how to prevent a health disaster. Next slide, please. So the first thing that we're going to talk about is metabolic and the diabetes. Again, working off of what Justin showed on the selfcheck.org. Now, specifically when we are talking about pancreatic insulin secretion, incretin response, okay, the genes that are highly influential in this particular pathway, they include the MTNR1B gene. This is the melatonin receptor in the beta cells, and risk variants of this gene tend to push fasting glucose higher by dampening or slowing down, not allowing that early morning insulin. So this is something that, if you're finding in your blood work, oh gosh, I'm eating all the right things, I'm doing things, but yet my fasting insulin seems to be a little high, check this gene. You may, you want to take a look at that. But remembering, genes do not exist in a vacuum. They work in pathways. Another gene to look at is the TCF7L2 gene. This is one of our legacy genes. This is one of the strongest common diabetes genes, and it affects GLP-1. Yes, that is a natural thing. It doesn't just come from, those shots and drugs that doctors have been giving out, but it affects your GLP-1 and mealtime insulin response. So definitely look at that. Also, a couple other genes that work together, the SLC2A2 and the SLC30A8. Now, these particular genes, they govern how well the pancreas senses glucose and packages insulin. So this is very important to take a look at. The SLC 3088 is that zinc gene that is part of our legacy genes. So that may sound familiar already. One of our newer genes is the GIPR gene, and this controls the GIP incretin signal from the gut, particularly after when you have mixed meals of carbs and fat. Okay, that will affect that. So why are these red flags? Well, these genes can identify pancreas vulnerable individuals whose fasting or after they eat meals, their glucose, if it drifts up years before weight necessarily changes. You'll find that people who have dysregulation in these genes, if their weight has been relatively stable in the earlier years, it's generally that midlife, that menopause, okay, that weight gain starts to creep up and show itself. So what can you do when it comes to prevention? Well, screening, okay, earlier and more frequent fasting glucose, the hemoglobin A1C checks. Okay, these are good blood markers that your doctor can actually prescribe for your blood work to get. And this is very important in high or higher risk genotypes of genes in this pathway. And you really want to consider periodic post-meal glucose, okay? Having a CGM, a continuous glucose monitor, taking a look at this, even if your BMI, your body mass index is normal. Again, we are looking at prevention. Kind of lifestyle things that you could do. So here's where you would have a strong emphasis on carbohydrate quality, making sure that you have a low glycemic load in the carbohydrates that you eat and those vegetables and fruits, high fiber, very, very important, and regular exercise. Exercise actually is fantastic to bring down that blood glucose level, especially after you eat. It can actually drop it by 50%. So, just a simple 5-10 minute walk can actually help to lower your post-meal glucose levels. And this is very, very powerful, especially in the TCF7L2 and the MTNR1B carriers when you have variants. For people with the GIPR and SLC 3088 patterns, you may prefer smaller, slower digesting meals. And again, walking after meals to blunt those glucose spikes, very, very important. When we're talking about how do I have the conversation with my doctor? Okay, because I've had many clients that go to their doctors and they're not familiar with how to implement genetics and functional genomics into what they're doing. So what you can do is talk to your doctor and say, my genetics suggest my pancreas is a little more fragile. Could we monitor my fasting glucose and hemoglobin A1C yearly, even though my weight is okay? Putting it in an asking format, but an informed, empowered asking format. Invite them to learn more. And this is very helpful as well if you are working with a certified functional genomics practitioner who can explain and walk you through your DNA 360 interpretation. So that way you are even more aware, have insight, and are prepared and confident when you do speak with your doctor. The second part of this is the obesity, appetite, and liver fat tendency. Now, several genes are going on here. So first of all, what do? So I'm going to group some of these in things that they do. So FTO, MC4R, LEPR, SH2B1, and NRXN3. These genes together shape hunger, fullness, reward-driven eating, Also, leptin and insulin signaling. Leptin being that satiation hormone, and obviously insulin helping to get the glucose from your blood into the cells where it needs to go. The PPARG, this is a master regulator of insulin sensitivity in fat and muscles. And then the other group, ApoA5, MLXIPL, PEMT, and the FADS1 and 2. These genes drive liver fat accumulation. They drive triglyceride handling and fatty acid composition, especially when we're talking about NAFLD. That's the non-alcoholic fatty liver disease risk biology, which, by the way, it has been updated, renamed, but I haven't memorized what that's called yet. So anyway, that information is in the new reports, so you can take a look at that. So why are these things red flags? Well, they don't diagnose obesity or fatty liver, but they do explain why some people gain central fat more easily and develop that NAFLD or insulin resistance at lower weights or at younger ages. So, what do we do as far as prevention? And this is a great fit, for a metabolic story if you are susceptible to that, or if you are already starting to see issues. The screening. So we're talking about for blood work, fasting lipids, triglycerides, liver enzymes, so things like your ALT, AST, okay? Also your waist circumference tracked earlier. Do these things while you are younger and in good health, and that way you can see any changes that may happen. Get your baseline, okay? Now, if you're already there and you're already like me, well, then got to start somewhere. Get a baseline, and then you can test those things based on changes that you make. Also, you want to consider liver ultrasound for those who have high triglycerides and genetic NAFLD loading. Again, if you have more of those variants in these genes, or they are higher risk genes for you, this is of a prevention. So go into your doctor's office, being able to ask and talk to them intelligently and informed, and they're more likely to listen and to work with you. So what about lifestyle? Like what can you actually do right now, even without the doctor? And, this is where, when we're talking about the appetite genes, so again, FTO, MC4R, LEPR, etc. You want to emphasize structured meals, high protein, high fiber, and removal of those hyper palatable, ultra processed foods from the home. Just get them out of your sight, get them out of arm's reach, because your biology does poorly with that type of grazing and food everywhere. And if it's more readily available, you're more readily to eat it. So for people with the NAFLD gene, so this is the ApoA5, MLXIPL, PEMT, and the FADS genes, you want to be careful of refined carbohydrates and fructose. You really want to restrict those. So when I say refined carbohydrates, I'm talking about the breads, I'm talking about the baked goods, I'm talking about maybe even rice, or things that break down into the glucose and fructose from fruit, okay, especially the really sugary fruits. They break down quickly, and you're not able to handle that as well. Also, you want to emphasize omega-3s and have adequate choline. So choline being in eggs, fish, cruciferous vegetables like broccoli, cauliflower, etc., because you really want to support liver fat export. We don't want it sitting there to then create that non-alcoholic fatty liver disease. And for conversations with your doctor, okay, so what do? Set the groundwork. Okay, given my family history, if there is a family history, and usually genetic, there probably is, and your liver fat genes, okay, Can we check my liver enzymes, and possibly an ultrasound sooner rather than later? So again, informed, confident, and respectful. Remember, these genes tell us whether your glucose system or liver fat system is more vulnerable. So this is where you can decide where your first priority is going to be. Is it going to be carbs? Is it going to be liver? Or is it going to be the appetite structure? Take it in workable steps, one thing at a time. Now, I purposefully went into a deep dive in this, okay, because one, you guys looked at that this was one of the major areas that you are interested in. I'm going to touch on some of the others very briefly because obviously we could go on a lot more time diving in, but I want to give you an idea on some of the other areas that are important to look at and some of the genes that are part of it. So next slide, please. So this is part of our cardiovascular red flag pathway. So first of all, cholesterol clearance and artery health. The couple of these other genes that I just mentioned, okay, LPA, ApoA5, MLX, IPL, the LDLR, this is a new one, this really works with that LDL cholesterol, triglycerides, lipoprotein A, and also these non-alcoholic fatty liver disease linked lipids. So this is very important that these genes, the fact that they help clear cholesterol and triglycerides from the blood and help regulate lipoprotein A. This, which, by the way, for those of you who don't know what lipoprotein little a is, it's a particularly sticky particle that drives plaque and clot risk. So why are they red flags? Well, when you're talking about variants in the LDLR, this reduces the number of function, the number or function, I should say, of LDL receptors. So LDL particles linger longer in the bloodstream and are more likely to deposit in arterial walls. When you have variants of LPA, that drives lifelong elevation of the lipoprotein little a. These levels largely are determined by genes, not lifestyle or statins. And variants in the ApoA5 raise fasting triglycerides and promote the fat accumulation in liver and blood, even if people who are not visibly overweight. So, this is something to be aware of. So different types of screenings, you definitely want earlier or more regular fasting lipid panels, and understanding that you would have a lower threshold to take these steps, to do these things, especially if you do have a family history in cardiovascular issues. Lifestyle things, Mediterranean style eating. That Mediterranean diet is really amazing, and there's so many studies on it and their benefits to eating in that fashion. But again, you can personalize it even more by using your DNA 360 and working with a practitioner who knows how to read that and to be able to assist in that. So looking at other things that you can do, blood vessel function and clotting. All right, so this we're talking about the endothelial lining and its function, thrombosis, or those clot, or your susceptibility for clotting. So this would be the genes ITGA2, NOS3, CRP, the VEGF. All of these really help in influencing how the endothelial lining, how your blood vessels work and function. Why are they red flags? Well, these patterns don't diagnose disease, remember, but they do tell you whose vascular system may run hot. And what do I mean by that? Having higher inflammation, not being supportive, maybe being more prone to that endothelial dysfunction. Remember that endothelial lining that lines the cardiovascular system, okay, that cardiovascular lining. There could be dysfunction in clotting and your inflammatory response. things that you can do, you know, again, screening, earlier screening, doing things like the high sensitivity CRP, C-reactive protein, and other inflammatory markers, blood pressure checks, tighter control on habits like smoking, different things like this that can really help, to not push you over into that disease state. Again, prevention. You want to have a strong emphasis on anti-inflammatory diet, high omega-3 intake, and even aerobic exercise. Next slide. Okay, I'm going to go through these a little bit more quickly. For hormone and cancer-related pathways, and I know that this can be a very intricate and nuanced area. So this isn't the end all. It's more of, some major ideas and places to look, to start looking, especially if there is any history of cancer or hormone issues in your family. So, things like the CYP19A1, that's the aromatase gene. It converts androgens into estrogens. The SHBG, this is your sex hormone binding globulin, and it really controls how much estrogen and testosterone are free versus bound. The SULT 1A1 gene, this sulfates estrogen metabolites. It also helps to detoxify some carcinogens. The CYP2C19 gene, this really is a matter of either a gain or loss of function, and it alters the clearance of estrogen, and it can impact cardiometabolic risk. There's some others here in the reproductive and pregnancy metabolism. And this is really, these genes influence pregnancy metabolic load, PCOS, polycystic ovary syndrome, phenotypes, bone density, and even gestational diabetes risk, which can be very relevant and relevant for hormone-driven and metabolic cancers over time. Why are these red flags? Because these genes highlight individuals who have lifetime hormone exposure, estrogen clearance, or pregnancy metabolic stress that can increase risk for hormone-sensitive cancers, things like breast or endometrial, okay? These are areas, these are specific choices that you could pick on selfcheck.org about prevention. So if you find yourself having, genes that are in this list that are at risk, and looking at the assessments and having a higher risk for that, go to selfcheck.org. Look at, if you're a woman, look under there, look at the different cancers, and also think about family histories. And then you can work through there as far as more prevention. Different types of screening is you want to, again, look at family history. You may want to get and do frequent breast imaging, self-breast examinations, being more cautious about use and duration of high-dose hormone therapy or estrogen mimetics that are in products, any toxins that you are bringing into your body that can disrupt those pathways that are already at risk. Different things as far as lifestyle, weight management, alcohol moderation, supporting detoxing your estrogen through fiber, cruciferous vegetables, exercise. All of these are particularly high yield when the pathways are dysregulated, okay? And let's see. Okay, so we covered that. Let's go to the next slide, please. All right, let's talk about neuro and mental health pathways. This is also very important and can really help with the way that your brain is functioning, stress response, trauma, sensitivities. And when we're talking about the group of genes, and there are many more, I'm just highlighting a handful. For the stress system and trauma sensitivity, Okay, so the genes, the I'm sorry, CRHR1, FKB, P5, and NR3C1. These genes are central regulators of how strongly and how long that stress system, the HPA axis, hypothalamus, pituitary, adrenal axis, fires in response to adversity. Now, when we are talking about IL-6, interleukin 6, IL-6R, the receptor for it, TNF alpha, TNF, which is tumor necrosis factor, and CRP. Remember that blood marker, that high sensitivity CRP, C-reactive protein? Well, there's a gene for that. And these are inflammatory cytokines and receptors. They affect that. And variants of these genes set the volume of inflammation in response to stress, infection, and metabolic strain. So why are these red flags? Well, because certain FKBP5 and CRHR1 patterns are strongly linked to greater vulnerability to depression, PTSD, and anxiety, especially in the presence of trauma or chronic stress. It's the classic gene and environmental interactions, okay? Loading the gun and pulling the trigger. So what we need to do is some of the screening prevention is having a lower threshold for early mental health check-ins, especially in people with trauma history or even early ACE, which is the adverse children events, okay, plus HPA axis risk patterns. All right, so you really want to get assessed and have someone to talk to early on before things become a problem. Also, check your blood levels, that HSCRP, your IL-6, when it is appropriate to track the overlap of these mental and metabolic inflammation. Because when we were talking about the metabolic aspect before, that plays into your brain. Okay, inflammation in the gut, inflammation in the body, there's inflammation in the brain, and that is going to affect stress levels, your brain function, the way that you're thinking, the way that you're processing information. So definitely best to get a handle on it, to have that information, and to do the prevention for it. Serotonin. Okay, briefly about reward addiction and emotional eating. So this works with the serotonin dopamine signaling and reward. So something I don't have on here, but is important because it deals with the serotonin, is the HTR1A and 2A genes. These shape serotonin receptor expression and feedback, and they are linked with depression, anxiety, and SSRI, that select serotonin reuptake inhibitor response. But the two that are listed here, the DRD2 and the NRXN3, these influence the reward circuits, addiction risk, and reward-driven eating. So why are these red flags? Well, that's because they can flag people whose reward and mood circuits are more vulnerable to modern stimuli, ultra-processed foods, substances, chronic stress. Okay, remember, it's not destiny, but it lowers the threshold for you to take preventative action. Preventative action, including earlier mental health check-ins, attention to patterns that look like emotional eating, substance use, or even any compulsive behaviors, different type of lifestyle things. This would be structured routines around sleep, food environment, even digital hygiene. Okay, not get into the doom scrolling and keeping that, as that focus. You want to be proactive in the use of psychotherapy or mind-body practices as soon as any type of friction might appear, rather than waiting for something to spiral out and for an acute situation where it's a bit more difficult. Remember, this is prevention. So these genes, they really help to identify the nervous systems, that feel stress more deeply or get hooked more easily. That means rest, stress skills, and environment matter even more, and early support does pay off. So is that our last slide? Okay, so in general, just want to briefly mention about systemic inflammation, detox histamine. So we are talking about inflammation. Remember, you can find this in our anti-inflammatory systems. And we've had little boxes on each of there to tell you which system report you will find this information. So for this part, inflammation, the genes that are listed there, I'm not going to read them all out. They are on the slide. They really read into the inflammation of these genes that set the baseline inflammatory activation, okay, and antioxidation defenses. Why are these red flags? Well, if you have a high inflammatory tone and weak antioxidant capacity, meaning that you're not able to get the antioxidants or these oxidants out of the mitochondria and cleared out of the cell very well, that accelerates almost every chronic disease: atherosclerosis, diabetes, neurodegeneration, cancer, and inflammaging. Okay. I'm sure you've heard that inflammation is the foundation for the majority of chronic diseases. And these are the genes, these are the systems to look at to see if you are genetically at a higher risk for inflammation tone. Okay. So for screening, if you find that you do have or are at higher risk in inflammatory tone, okay, then you want to make sure to check those lab markers, the HSCRP and other markers, particularly if they are combined with cardiovascular or metabolic genetic risk. Different lifestyle things, anti-inflammatory nutrition, okay? Look at the types of foods that you're eating. You want to make sure that you have movement, that you have good sleep, that your stress level is lowered, and that you have the tools to work through stress, and also that you have targeted support for pathways such as the glutathione pathway where appropriate. Again, we do have these pathways listed in our reports for glutathione. We have one in our anti-inflammatory systems report, as well as methylation and all the others that you can actually take a look at and see how you stack up in those particular areas. Now, histamine, this is a new one that I think is absolutely fabulous that we have added on. And the AOC1 gene encodes for diamine oxidase, DAO. And this is the main enzyme that clears dietary histamine in the intestines. And why is this a red flag? Well, what happens is lower DAO capacity doesn't cause disease by itself, but it creates a body, your body, that is easily pushed into symptoms like bloating, migraines, flushing by common foods that you eat, or if your gut is off, if you have dysbiosis in the gut. And when you are adding a background of distress, that often can derail any prevention plans. So know where you are with that. Certain screening things that you could do. Really, it's primarily symptom driven. So you want to look at patterns, gastrointestinal or migraine flares, especially after high histamine foods. Leftovers can increase, well, they do increase in histamine levels. So especially fish, I really highly recommend not having fish leftovers, beef and other foods. Those, try to eat up those leftovers within, 24 to 48 hours, because the histamine levels increase, the longer it stays in the fridge. So for those things that get stuck in the back of the fridge, and then all of a sudden you go, oh, that's still there, toss it out. So really, it's important that when we talk about these genes, these red flags, we want to make sure that you understand it's not that it screams heart attack risk. Okay, remember, it's not diagnostic, but it will influence the quality of your life and adherence to any long-term prevention plan. It's really a matter of have the knowledge, go in it in a calm, curious way to gather the information, know where you're starting with, so you know where you're going and what to focus on. So I appreciate you guys allowing me to take up a lot of that time. I think this was very important for me to go through these systems and genes, help you to dive into your reports, to learn more. And if you don't have your reports yet or your new genes, I hope this encourages you to get those that new upgraded test, so you do have these genes to better help you become more informed and personalize your prevention care. So Justin, I'm gonna tie a little bit of that together.
Yeah. First of all, you guys all know Dr. Laura is the dean of the DNA University, right? And I think you just saw why. That was beautiful. That was a master class on a lot of the new stuff that we did. So great job on that, Dr. Laura. And it's important to know too that when it comes to this genome sequencing thing, there's a lot of genes out there, right? And there's genes that have a lot of not real relevance on the clinical side of things. Like there's genes that determine whether or not you can do the U thing with your tongue, right? That thing, and stuff that doesn't really matter that much when we zoom out and we're trying to identify reasons for people's health problems. So all of the genes that have now been incorporated into the DNA 360, there are very valid reasons. These things have been hashed out, and it's not something where we're just like adding willy-nilly genes that are just kind of fun to add in. They're clinically relevant, and they also complement the systems that we already look at, right? So Dr. Laura just went over like a lot of different stuff in the mood and behavior segment. We already had a very well-rounded profile there, and now we've added and expanded so that there's more and more nuance to it. The cardiovascular panel, all the things that we talk about with inflammation. Well, now we can look at histamine and DAO and tumor necrosis factor alpha and these kinds of things. So now, when you pair it with high quality lab work and some of the different self-assessing metrics that we can use, now you're getting a really broad view about what your actual health picture looks like. And it's kind of like a three-step system, right? We go to identify which systems are genetically vulnerable. We use genes and things for that. Prioritize is the next step. And now we know what's going wrong. So, okay, let's prioritize this area over that one. And then the third step is act, right? Action. That's always what gets you there. That is epigenetics, is action. So screening, lifestyle changes, clinical follow-up. That's the three-stage approach that we talk about. And I'm very excited that we have all these new genes and that we have different tools. We're constantly expanding. We also have a heck of a lot of questions, so we should likely dive on into those to make sure that nobody gets left out here. What do you think about that, Dr. Laura?
Sounds wonderful. I just opened them up. All right. So just to let you know, I obviously have not read through all of them, but we cannot give medical advice. So anyone who may be giving us, hey, these are my genes, tell me what to do, we can't answer that, okay, because we don't have the full picture. We can give general information, specific information, as long as it fits within what we've talked about within this webinar, but we definitely want to respect people's privacy as well as the information that we give. So with that being said, let's see. Our first question is from Deborah. And let's see. She just went through the DNA 5-pillar program. And when she looked at her genes, especially hormonal and cardiovascular, seeing there may be toxic estrogen, it's overwhelming. I can agree with you, and that's why it's very helpful to have a practitioner who can read these, help walk you through that, and explain it a little better. So anyway, she's saying, how does one find a woman's health practitioner to help with postmenopausal symptoms and BHRT, keeping in mind the potential for our genetics that may be suboptimal in estrogen, testosterone, progesterone, etc. Most OBGYN folks have no idea how to prescribe BHRT given the genetics. And you are absolutely right. And we see this all the time. And this is why we here at the DNA Company, we do have prescribing doctors on staff who are fully certified in functional genomics with our tests and can offer that information and even help to prescribe, if indicated, for your specific case, BHRT. So if you are interested, which it sounds like you are, please contact us. We can drop the email in the chat that you can speak with one of our team and see if a program will be right for you to be able to discuss this, and who are fully informed, aware, and can interpret your genetics in the perspective of hormones and bioidentical hormone replacement therapy. So,
Yeah. Sorry, can I just add to
this.
that quick, Dr. Laura? When it comes to BHRT, especially, understanding the steroid hormone pathway is very, very important because it cuts a lot of that trial and error process down. A lot of people are, concerned about going on hormone replacement therapy because there's so many horror stories of it being done wrong, and improper titration and things like that. Well, it's because if you take hormones in exogenously or if your body makes them endogenously, there's still the same enzyme pathway steering what happens to it downstream, right? So if you make estradiol or if you take estradiol, the things that happen in the pathway after are still the exact same, right? Because this is the hardware that I mentioned earlier in the call. So having someone understand how to prescribe BHRT, bouncing it off of this steroid pathway, it really cuts down a lot of the risk factor there because they know what intervention to place and they know what's going to happen downstream of placing that intervention as well. So when it comes to messing around with hormones, definitely the genes are one of the most valuable things you can add in. I think all endocrinologists and different practitioners there, they should all have some genetic knowledge because it goes a very long way.
Yeah. And the nice thing is that with our DNA University, we are seeing more and more MDs from all various specialties becoming students and learning about functional genomics and how to interpret genetics and our test to incorporate it into their practice. So, this is what we are working toward, to expand that, to educate our doctors in Western medicine and allopathic medicine so they can, really expand their knowledge to help you even more at that personal level. Because personalized medicine, this really is where it's at. This is where the future is. All right. So our next question is from Gil. And Gil's saying, I'm not familiar with selfcheck.org, but from what you showed, it looks very much on the medical allopathic model. How do you find it? And go ahead.
Yeah, I was going to say I would say, yeah, absolutely. The medical allopathic model, like allopathy really is subclinical, right? It's that preventative maintenance. And, you can provide allopathy to people with supplements and it's that baseline relief. The medical system does allopathy. Health coaches can do allopathy. And I think self-checking is definitely kind of in that same realm there. So as far as where do you find it, I'm assuming you just needed the name of the website again. So it's selfchec.org. I'm guessing that's what that second part of the question is referring to.
Yeah, but really, I mean, yes, it's built in that conventional medical language, but that's actually why it works so well as a partner tool. We are not trying to say us against them. We are trying to build a bridge. Okay. We are trying to increase that knowledge, that empowerment for yourselves of things you can do on your own, but also to be knowledgeable on where to start to be able to work with your primary care physician or whatever specialist if you've already got some issues and you don't want it to get worse. You know, it really should be used more as like a neutral guideline or guideline aligned checklist for what to check when. And then you want to layer functional and holistic strategies on top of that. Nutrition, sleep, environment, genomics, all these things that I talked about when I said, hey, here's, this would be your, your prevention checklist. This is, for tests that you'd ask for, because a lot of times you got to have your doctor prescribe or, request those tests. I mean, there are sites that you can go to and order your own blood tests now. Thankfully, they do have those, but you really want to start layering and building that bridge more rather than treating it as a purely allopathic roadmap. Okay. So, which actually kind of works into one of the other questions we have, which was, and I'm going to jump down to, actually, Roberta was the next one where explain where on the self-check website that the genetics can be integrated. Where can you see the information about the genes? You're not going to find the information of the genes on the selfcheck.org website. This is where you have to put in a little bit of work to, what are the things that you're worried about? So, I mean, it's kind of like 6 of one, half dozen of another, of a chicken or the egg type of thing. Do you go to selfcheck.org first? Do you look at your DNA first? Okay. So either way, bring them up together. Okay. If you're looking at your genes, where do you have susceptibilities? Where do you have family history issues? Where do you have, maybe some current issues that are not real bad, but you're slightly worried about? You can validate that with your genes and go on self-check and go, okay, so this is where I want to focus. Let me go on self-check. Let me take a look at this area and see what type of preventative measures I can take from here. And then also, there are things that we have in our DNA 360 reports that give you recommendations if you have certain variants or risk in that assessment. These are things you can do. So that covers your holistic, natural ways, because all of our recommendations are, they do not include prescriptive medication. It's not a medical diagnostic type, way of treatment. Okay. This is more of holistic, functional health. So it's putting in that work. So you take a look and, work them together, bridge them together. All right. And I think that kind of answered the next one from Marianne, because she said many of the genes do not appear on the old DNA 360. Are they in the new test kit? And that's something that I answered as we were going. Correct. A lot of the new genes, I mean, we have more than doubled the genes that we report. So yeah, if you want to see those genes, get that upgraded test. Okay. We put the link in the chat, and we have a 10% off discount for DNA 360 testing. You can use the code RED FLAGS, that's REDFLAGS at checkout. And if you have already done your DNA 360 and want that upgrade, there is special pricing, and it is cross-matched to make sure that you have done your DNA 360 previously to get that lower price. All right. Next question is from Lisa. Where do we see all the genotypes in our DNA 360 report? Pancreatic insulin, obesity slide. Okay, those you will find in the, hang on, let me just double check. I believe that's diet nutrition. And okay, it's in under the diet nutrition summary system, that system report. And then you will see uh, assessments. Okay, you'll see system summary, and then it'll say obesity tendencies and satiety and appetite and carbohydrate metabolism, glucose regulation, histamine and DAO function, etc. So that's the report that you'll be looking at. And we actually had that marked on that slide. It says, to get more information, it's in the diet nutrition system. So each slide told you which system report that those genes will be found. So you can always watch the replay. You can pause, take some notes, and then go into your reports and take a look. And of course, don't forget the newer genes you're not going to see unless you do upgraded report or test kit, or if you're brand new, if you do a new test that will have all of the genes. Okay. Next one is from David. And can genetics influence the size of your LDL particles? Small, dense, higher risk, even, I would say, I think you meant to type even if LDL is low or is more diet driven. And I'll take this. Sorry, I didn't mean to monopolize the answers here, Justin. The answer is yes, genetics can influence, absolutely, your LDL particle size and density, even when that total LDL-C is normal or low. Some people actually have genes that favor higher triglycerides, and that would be ApoA5 and MLX-IPL function, okay? Or even inflammatory tone, which can then push them toward those smaller, denser LDL particles and higher risk at any given LDL level. So yeah, diet, lifestyle, these help to modulate, these help to I hesitate to say the word fix, but they definitely help okay, when you have inherited patterns that can skew your LDL pattern, all right? And we're talking about like refined carbs, sugars, trans fats, low activity level. These all make those small, dense LDLs worse. So this is where you want to focus on the fiber, the omega-3s. You want to, have more movement. That can shift your LDL pattern toward that larger, more buoyant LDL. And this is important because a lot of people are worried about this and they wonder about this. And they're like, I'm doing all the right things, but yet, well, that's why. Okay, it's not your fault, but really lean into doing those good habits that can help shift it slightly, at least to what your genes will allow. All right, so Mary Ann is asking, she read that choline increases TMAO, putting the colon at risk. She says, I assume this is dose dependent. How much choline is a problem? Okay. So she's talking about a gene saying that she's short of choline. So, and she's talking about number of eggs and all this is that overdoing it. Justin, do you have a comment information on choline and TMAO?
Yeah, so I think it is dose dependent, but it's also microbiome status dependent as well. That's another kind of consideration there. And it's also gender dependent as well with regard to dosing protocols, right? So it's hard to pinpoint down what the actual dosing is too much. You may have symptomology associated with like too much neurotransmitter production and anxiety and things like that. But I mean, as far as normal versus excessive choline levels, typically women would be like 400 milligrams a day would be kind of in the normal. But then if you exceed that, it's in the upper limit. Remembering that men can probably take like 100 milligrams more than that. I eat choline, and then I also have choline in a lot of my supplements, like different nootropics and things like that. I think choline is very valuable, and you probably should have a pretty consistent supply of it. the amount that you're getting in the eggs is not going to be extremely high because you're only having 2 eggs. I don't think that you're going to be pushing it too crazy if you keep consistent with that. But then adding in the 1,000 milligrams with the alpha GPC, I would consider that a sizable dose. Again, I don't know your whole health backstory and microbiome status, liver status, etc. I would say that you are on the upper echelon there, though, as far as dosing. So maybe be aware of that and pay attention to if there's any kind of symptoms, anxiety, just central nervous system activation, that kind of a thing. Any thoughts there, Dr. Laura?
Well, I do want to say that TMAO is really driven by your microbiome composition.
Yeah.
So gut bacteria first convert choline, carnitine into TMA. Liver converts it from TMA into TMAO. So, really, do you have the gut bacteria that make that conversion more? Because if you don't have it, then you don't have to worry about it. So, the more you have, well, there's that too. So it's not just one thing. It's not just about eating foods high in choline. There's more to it than that. So just wanted to make that distinction. All right. So Pamela's asking, are these red flag pathways only on upgrade? And for the most part, yes, simply because they include a lot of the new genes. So granted, there are still several legacy genes that are included in these pathways, but you won't have as full and rich of information of even more precision without the new genes. Because remember, we've more than doubled our genes so that we present. So it's definitely helpful to get that upgrade. Okay. Excuse me, Megan is saying, is there a reason 9p21 is not included as a red flag in the vessel function? And okay, so it's not that I purposefully left it out. I wanted to more highlight some of the newer genes. And I also had mentioned this is just a spattering. This is a handful, but really there are so many genes that go into these pathways that affect. That's why we have them set up as assessments, as overall functional assessments rather than just singling out a bunch of genes. But yes, 9p21 is very important because it talks about how sensitive your endothelial lining is, how quickly you become inflamed in the presence of toxins. So yes, that is very important. But again, I'd be going on for hours if I listed all the genes that are important and that impact each of the systems. So
yeah, or the interplay between the legacy genes and the new genes as well, right? Because really, I mean, if we were to do the fullest seminar possible on all of this, we would be remiss to not talk about the glutathione pathways and all of the other anti-inflammatory stuff that we talked about. That would tie beautifully into all the things that Dr. Laura mentioned with IL-6 and TNF and histamine DAO and all the blood sugar regulation genes. I mean, there is so much that we already cover that the new genes are a complement. It's adding nuance to the conversation. But for the purpose of tonight's webinar, there's no way that Dr. Laura's windpipe can deal with going over all of the legacy genes and how they connect. But you're absolutely correct. I mean, 9p21 is one of the most important variables there possible, and we connect it all. So Dr. Laura was really giving a presentation today to kind of incorporate what we're now looking at to expand upon the conversations we've already had.
Yeah. And I mean, just to give you guys a slight little hint, and for those of you who may be DNA University students for our Certified Functional Genomics Practitioner course, the new genes, the videos that Dr. Kosterman has recorded for the training on the new genes totals 9.5 hours, if that gives you any hint. So there's a lot of information. There's a lot going on there. So yeah, it would take several webinars, which, if you're a student, we are trickling them out and teaching about them in our Genomics in Practice webinars, which are for students and preferred providers. All right. So here's a quick a question. Pauline asks or says, no leftovers. What about freezing batch cooking? I love that. Yes, because that actually pauses and well, not totally pauses, but very much slows down bacterial growth and histamine growth. So, yes, if you are, if you cook on the weekends and you have to cook for the week, have some frozen, obviously keep some out, for the next, 24, 48 hours. The rest freeze and take out, in a structured fashion. So, yeah, that's fine. All righty. Is there a question you see here that you'd like to quickly dive in? Oh, let me answer this. Gil said, are the BRCA genes included in the DNA 360? And the answer is no, because we do not chase after diagnostic type. We're looking more at foundational root causes, and we didn't find that to be as impactful as looking at the reason why it could possibly get to there. Not saying that they're not important, not saying that they're not impactful. It's just, again, we are looking more at the root causes at that foundational level that are clinically actionable. And these will cover, even if you are, BRCA positive and have the variant of those genes. If you look at the hormone genes, your inflammation, all of these other things, and work toward fixing that, you won't have to worry about if you're BRCA positive. So we want to clean the terrain, strengthen your foundation, and those other things downstream tend to work themselves out.
All right. I'll answer Suzanne's question here. So
Okay.
she basically says her DNA 360 cardio report suggests only doing 2 cardio workouts per week and no higher than 60% of her max heart rate, and for a maximum of 45 minutes. And she's been a track athlete for a long time now. And she actually has a 6 minute mile, which is fantastic. And she's basically feeling that the recommendation within her cardio report is not quite enough to maintain some of her athletic goals. So some of the reasons why the cardiovascular report says that is because of not having a great, response to inflammation with the 9p21 gene and different things that we talk about. So for me, nothing in the DNA says that you have to live this way or can't live that way. And I, as a coach, certainly am not going to tell you not to live how you want to live. But what I would say is that the management of inflammation can really help you there. And that should be your top priority if this is something that you want to continue to doing, because the genes, they're your assignment, right? And we need to live in alignment with our assignment. And if you choose to live in a way that is out of alignment, the best thing you can do is add in interventions to counteract some of the downsides to not living in your assignment. So if your assignment is such that you don't deal with the inflammation very well and you probably shouldn't be doing a lot of cardio, but you want to, well, that means that what we need to do is identify what the red flag actually is and then add anti-inflammatory strategies, detox strategies, etc., for helping to deal with that. So if you're going to continue to do, pretty high frequency cardio, maybe it's a matter of surrounding those bouts with anti-inflammatory strategies, like getting in the sauna afterwards, grounding beforehand, improving detox. I mean, you can use things like hydrogen water. Maybe it's a matter of doing cold exposure afterwards. There's a lot of ways that you can help to mitigate that inflammation. I would also zoom out on the rest of your report and understand what areas your body isn't detoxing very well. Like if you don't do, reactive oxygen species clearance very well, right? So there's a gene called SOD2 that does that. And if you do a lot of cardio, you're going to be accumulating a lot of these free radicals. And so maybe it's a matter of improving that clearance, right? With some carbon 60 or again, hydrogen or high ORAC foods or whatever it is. Manage inflammation and improve detoxification. Pay attention to your HRV as well, because that'll show you if you're overtraining, and that can allow you to continue to live your life the way you want to live it. But red flags are there for a reason, and you may want to add in some recovery days as well. That can always go a long way.
Fantastic. And Our last question, which, by the way, before I answer this, I noticed in the chat, Lisa said the link for the $199 upgrade test kit isn't working. Actually, it does. If you have already done a DNA 360 test in the past and you want to get the upgrade, when you click on it, yes, it's going to say $499, but click through, put it in your cart. And then when you go to checkout, when you put in your email, make sure to use the email that is associated with your original DNA 360 test kit report, because there will be an automatic check to make sure that you've had one in the past, and then it will change that price to $199, but it won't do that until you put in your email. So yes, it does work. You just have to go through the rest of those steps. So I wanted to make sure everyone knew that. Okay, so our last question is from Mary Ann. She says, for the FUT2 AA version, which is the suboptimal. Okay, FUT2, basically what this does is it indicates how well your body transfers B12 from the gut into the bloodstream. Okay, if you have an AA, you're not doing that very well. So she's asking, well, having that, is it okay to take food-based B12 from like dehydrated organs, or does it need to be sublingual synthetic? Well, first of all, not all sublinguals are synthetic, but I mean, obviously you can take food-based, dehydrated organs, which are wonderful for so many different reasons. But whether you are getting enough B12 from the gut to the bloodstream, that's something you have to look at in either a micronutrient test, blood test. Check it out. If your levels are really low, then obviously that's not enough. And you will have to do some sort of sublingual or even transdermal, patches or something to get that B12. So test, don't guess, check to see. And that's by checking serum levels and micronutrient levels. Okay, so I've been talking too much.
Yeah, and by the way, it doesn't mean that you're not going to be able to absorb any of the B12. It's just going to reduce the amount that you can, right? So, I mean, utilizing organs is still a fantastic strategy because of the concentrations that are in there. You're better off with the organs than without it when it comes to the amount of other micronutrients that are in there. They've also got naturally occurring peptides. And I mean, there's the kind of organ adjacent stuff going on there where you eat heart, it's good for your heart. You eat brain, it's good for your brain. There's a lot of that correspondence going on in there. So still include that. But because of the FUT2 secretor gene, I mean, you may not be getting it. And the thing about sublingual is that it bypasses that whole digestive process and it makes it so that you don't have to worry about all that enzyme activity. Right. So I think that's the value there. So maybe rely on the organs and then now and again utilize a sublingual format. Pay attention to your whole methylation pathway, by the way, because then it'll tell you what form as well is ideal for you in supporting your genetics.
Perfect. Well, with that, thank you so much, Justin, for being a great co-host. You are always wonderful, informative, and just brilliant. And I want to thank everyone for joining us. I know this was a lot of information, and yes, introducing a lot of our new genes. I do encourage you again, please look at getting the upgrade test if you've already done our DNA 360, or if you haven't done your DNA test, get it now. You'll get the new genes. So until then, have a fantastic night, and we will see you at the next one. Take care.
Thanks, everybody. Take care. Great job tonight, Dr. Laura.
Thank you.
Bye-bye.